Welcome everyone to tonight's webinar, where we will hear from a few families who have been through the epilepsy surgery journey. My name is Rena Loughlin, and I'm the Program Director for the Epilepsy Foundation Eastern PA. It's my great pleasure to be one of the facilitators tonight, along with my friend, Dr. Akila Venkataraman. We have had a fantastic pediatric surgery webinar series in which we have heard from expert healthcare professionals in the field of pediatric surgery. And tonight, we want to conclude our series by providing you the opportunity to hear invaluable perspectives of pediatric surgery from families who have themselves been through the process and can share with you what they've learned and experienced from the surgery journey. Now, I will pass the mic on to Dr. Akila.
Hello, good evening, everybody. As Rena mentioned, this actually has been a wonderful webinar series introducing the very scary concept of epilepsy surgery, especially in pediatrics. As you have heard over these series, epilepsy surgery is actually one of the very important and probably underutilized or underthought options for management of epilepsy. There have been so many advances in surgical techniques and studies that now propose that there is a much better outcome in pediatric epilepsy the earlier you start considering surgical options for seizure control. So without further ado, I'm actually going to introduce you to some people who have actually gone through that journey themselves. And I feel like, they'll be able to give you a much better perspective of what it's like to consider epilepsy surgery in pediatrics. So first up, I invite Heather and Colton to come talk a little bit about their surgical journey for Colton's epilepsy.
Thanks, Dr. Akila. My name is Heather Seibel. I have a 5-year-old son with epilepsy who just recently underwent a right hemisphereotomy on July 27th at CHOP with Dr. Kennedy and his PA Kathleen. And for us, it was a scary prospect. The thought of a person that you only meet once cutting deep into your son's brain and forever altering his life was terrifying, to say the least. But it was a decision we knew we had to be made. And the easiest way, when people ask me, why did we do it? His epilepsy was never going to get better. He's one of those kids that was going to progressively get worse. We were intractable. Medications weren't helping. So that's why we went the surgical route. My son has had epilepsy since he was 5 weeks old from an injury and tried many medications. And when the seizure started happening more often, that's when we had a surgical consult. Met with a surgeon and went in for testing. For us, our testing included a new MRI and CAT scan to make sure nothing had changed, and video monitoring to try and capture some seizures to definitely narrow down where they were coming from, which we did. And then surgery was scheduled for a few weeks later. We had a great time with our physician, who explained things to me. He didn't dumb it down for me, but he wasn't super scientific either. He made me feel at ease, answered all my questions. So for those of you considering it, take someone with you, take notes, ask follow-up questions. Those were all things that we did do. But for us, our surgery was July 27th. It was a 13-hour-long surgery. We were updated throughout the process of how he was doing. We ended up in the PICU for a week, which is what we expected because of the drain. They told us we would be on the epilepsy unit for a week for medical management. We stayed 1 day because he did so well. And then we did 6 weeks of inpatient therapy to regain some of the things he lost. Now, I will say, for us, it has been all positive. My son before surgery had seizures, obviously, but we didn't realize how much they were affecting his development. So my son that said 2 words before surgery, eat cookie, go out, me, now tells you, I want a chocolate chip cookie. They're very me. Can we go to Target, Mom? I want to buy a tractor. In 3 months since the surgery. He's also recognizing his letters, his numbers. He can write his name now. He could do none of that beforehand. And we just didn't realize how much maybe background activity or the seizures were affecting him until after the surgery. So for us, it was good. We have been seizure free since the surgery and have been only making positive gains. Cognitive wise, perfect, seizure free. We've got return back in our left leg. He walked out of rehab, still working on his arm, but it's more than just hanging there. He's using it. He's able to sort of hold things. And with intensive therapy, we feel like we're going to get back to as close to baseline as he was. And again, the recovery for us was very smooth. I will say sometimes it's not all sunshine and rainbows. There are times when he still gets a little frustrated, but we had some major behavior issues before surgery. So I will take a little frustration here and there. And it can be draining. It's kind of scary to think that someone's going to cut into your son's brain, and it's someone that you met once, and you know that they've went to school and they've done this 100 times, but it's your baby. And that's why I'm here tonight, to answer any questions that anybody might have, because us mom and dad stick together. We're the ones that are going to tell you the real deal. We're going to tell you what it's like. We're going to tell you the good, the bad, the ugly. And for us, it was just great. People kind of look at me strange when I have a big smile on my face and say, my son just had brain surgery, because my son just had brain surgery and it's given him a new life. I cry at least once a week thinking of all he's done in the past 3 months during his recovery that he couldn't do before. And my worries for his future, like, was he going to be able to live on his own? Was he going to be able to be seizure free? Have all pretty much disappeared, because we've just made such progress.
Thank you so much for sharing, Heather. And thank you for kind of being vulnerable and sharing your personal experience and being open to questions. And we will have questions and answers after we hear from Carrie and Grace.
Okay. Say hi.
Hi.
Hi. So my name's Carrie, and this is Grace, my daughter Grace. And we live actually in Greenfield Township, which is about 20 minutes north of Scranton, Pennsylvania. All right. Grace is 11 years old, quickly coming upon 12. And her history with seizures is, a lot of it's unknown to us. Grace came to live with us when she was almost 5 years old. I'm sorry, we're going to push buttons and turn it off. When she was almost 5 years old, she came to us. She is originally from China, so our information is limited, but she came to us with diagnosis of a seizure disorder, congenital heart, a couple other things. The seizure disorder, we really couldn't get a good feel as when those seizures first started for her. And for us, the seizure path was kind of, it was really inconsistent. She lived with us for about 2 years before her seizures really started for us. We were working very hard on not having her on any medications. And unfortunately, in 2017, her seizures started and really took a hold. And I learned what a seizure was and what it was like to live through and see happen to your child. Her seizures kind of revved up, and I say revved up knowing that there's families that experience multiple seizures a day. For us, revving up was maybe a seizure every month, sometimes twice a month, and then in the past year, probably we've tapered out to every 6 months. It's always been a discussion for us as a family. I mean, her seizures for most families would be well controlled. Many families would love to have seizures, only that limited amount of time. But unfortunately, Grace, the severity of Grace's seizures were of great concern. Her seizures, we could not break even with her emergency medications. we have such a ritual of her medications every day, giving them to her, immediately giving her the rescue medication, calling 911, and no matter what, we couldn't get them to break. And what became even scarier is the past couple that she's had, it's really affected her breathing. Even with the rescue medication, her oxygen levels would drop so low. We live in a rural area, so while our emergency response crew is fabulous, there's only so much somebody could do to get to our house. And so we found ourselves really in a concerning way. But Grace, so it really became, well, what's our next options? How can we stop these seizures, or what's another layer that we can look to? And I know, Grace, we went in May, and she's had a couple inpatient long-term EEGs, and those of us with who have experienced the seizure process, those EEGs oftentimes are not helpful, only because Grace doesn't have a seizure when she's in the hospital. Our hospitalization was about 7 days. If I missed her medications one day at home, she would have taken a seizure on me. But sure enough, in the hospital, we didn't have a seizure. Despite all of that stress. And we really were just looking for what's the next layer, because let's be real, one of our biggest fears was that we were going to lose her with a seizure. So it really was just, what's another step that we can do what's another intervention? What else can we do to help this process? I'll be honest, we were hoping for, and I'm not sure of the name of the seizures. I'm going to look to those medical professionals, or not the name of the surgical intervention, but it's the leads that actually are inserted in the brain where the seizure is happening. Honestly, that would have been my preference for her. It would have been more immediate. I would have had the ongoing testing or imaging. But because she didn't have a seizure, that became not an option for us. And the other option was the vagus nerve stimulator, which, please stop, which had been, which was, our doctors really explained it very, very well to us. The team we had it done in Janet Weiss in Danville. It's a Geisinger facility, and the team really was great. They did her cardiac workup, they did a new MRI, they did all sorts of imaging. She does have the congenital heart and a history of surgery, so we had to make sure that was okay. But we really, it really has been, it's just an added layer for us. And the surgery was, we were released to come home for a day after her EEG stay, went back in for the surgery, and then we were just there overnight after the surgery. We were able to come home, so it was a much quicker process. As far as her experience, Grace is, as many kids are, amazing as far as her response to things don't bother her. Mom, she moves on. Okay, we're talking, but things don't bother her, other than maybe itchy when it was healing and picking at the glue, the surgical glue. She's been great. We've gone a couple times to Dr. Akila, and she certainly, she's, please, I'm not medical. She's turned up the power of the machine a little bit, not much. I think the last time it was turned up, we did notice a little bit of cough with it, but that quickly went away. Now, I will say Grace has been seizure free, and I hate to say those words, since her surgery. And like Dr. Akila and I talked about at her last appointment, was we really don't know if it's because that machine is constantly giving, it's constantly giving some impulse. If that is enough to stop it, or just keep her seizures at bay, or if it's just we're in a good stage. Either way, we'll take it. I know as we move along, we're maybe hoping to look at taking her off some of her medications, but we need to have the stimulator at the right level just to make sure that can intervene for us as well. So,
Dub.
What do you want to say?
No, I'm on my thing.
Okay. But Grace is amazing. Like, she really is just an amazing kid. She's super smart, super independent, or wants to be super independent, and she keeps up with all of her activities. It really didn't slow her down at all. So we're appreciative of that. No, we're not talking about that right now. She's very determined, by the way. So I'm happy to answer any questions. You know, I feel like our path has not been, it's been traumatic, but you know, I kind of take things as they come. That's my personality. I'm not too reactive. I don't know if that's a good thing or bad thing in my life, but it's where we are. So, but thank you, everybody.
Thank you so much, Carrie and Grace. Just thank you for being so open and honest. Hi. And thank you for sharing your story. At this time, we would love to have questions from the audience. So if you could put them in chat, and we'll read it out to our families and to Dr. Akila as well. So yeah, just put your questions in chat.
Actually, I have a couple of questions just to Heather and then Carrie. Just to sort of, maybe these are questions that people might be thinking of. So with either surgical procedures, have there been any changes in the medications that your children are taking? Has there been a consideration of maybe decreasing the medications?
For us, we talked, we're going to start reducing our seizure meds in 6 months if we go 6 months seizure free. But I'm happy to say we also weaned off of 2 of our headache medications because my son constantly had headaches and pain. So we were able to successfully do that. So again, like, it's been good for us. So we're still hoping.
Yeah. And as Carrie mentioned, she and I, we've been in conversation about, you know, hopefully, you know, being able to drop the medications, if not completely remove them. Again, a lot of these surgeries are adjunct to medication for seizure control. But if we can actually decrease the amount of medication that one takes, and still establish good seizure control, then that mitigates some of the side effects, right? So, all right, looks like there's a lot of questions coming about.
We have a question of who guided you in the process of choosing your neurosurgeon?
Oh, for us, it was just the neurosurgeon at the hospital where we saw neurology. They had been talking back and forth previously, and then we were presented for conference. But I had actually previously heard of him and his experience, so I was a little more confident going in.
I believe your neurosurgeon is actually logged on to this webinar. Dr. Kennedy, yeah?
And I
hello.
I had talked with other parents too who had to reassure me, and I had a mentor parent who guided me through the steps, and then I went on to try and help someone else as well. But just a good network of other physicians, other moms, other kids, you know, who've had this experience before.
And Carrie, for you?
Well, again, it was the neurosurgeon that through the hospital setting where we were at. That being said, we've been with our Geisinger neurosurgery, Geisinger pediatric neurology since we started, since Grace came home with us. So we have confidence in their guidance. We've had multiple hospitalizations, had great conversations with the neurology team, and her neurosurgeon, Dr. Shimoni. It was interesting because he had previously last year, my son had a brain tumor, and he was his neurosurgeon. So I really had confidence in him, and you know, and that was helpful, but it really came down to who was on the team with the hospital.
Great, thank you. How did you speak or explain to your child this about the surgery that they were going to undergo?
Kind of frankly, not in a bad way or a harsh way, but more just that, you know, she had already been in the hospital several days before then. She was pretty much worn out from the hospital, being there and kind of stir crazy. But it was really just the idea that we needed to get this done to help get her seizures, to help her keep her out of the hospital moving forward. And that was kind of where Grace's understanding would be. You know, and she was going to have a boo-boo and she was going to go to sleep and wake up and we were going to be there with her. But that was our preparation. It may have been different, just that's where Grace is. That's what we needed to do for Grace.
Yeah.
Exactly the same for us. I think the more challenging was explaining to my son's siblings of what was going to happen, that Colton was going to look a little different and move a little different and not be able to maybe play the same way he used to. So we just kind of just did it in little dibs and drabs, like nothing too dramatic. Just, hey, you know, Colton's going to have this surgery. He's going to be out of commission for a little bit, but he's going to get stronger. And that's how we kind of present, just very gentle and in small little non-scary ways.
Wonderful, thank you. Another question, how many medications did your child try before considering surgery?
I'm going to say we were at 6 or 7.
Okay.
And different combinations of those 6 or 7 as well.
Gotcha. And did you get a second opinion for your child's surgical procedure?
For me, I didn't. From the time I met Dr. Kennedy, I felt very comfortable with him. I just, like I said, the way he explained things to me and talked to me, not at me, talked to me, showed me the pictures, showed me what he was going to do, and just really confidently explained without being too cocky, because sometimes surgeons have a reputation of that, but he just was, I don't know, I just felt very at ease with him and his team and just the way they spoke with me. So for me, I was happy to be able to sign to make the decision that day.
Wonderful, thank you. And then Carrie, I think you might have missed one of the questions was, let's see, how many medications did Grace try before considering surgery?
Well, Grace is currently on 2 medications. I think it was 3 total is where we had been at. I think our concern was increasing the medications. We're very cautious of how much we want to increase her, and her levels were right. I mean, her levels are therapeutic typically, but how much medication we wanted to put in her system and take other functions away from her was our concern. We've been very cautious about that throughout our whole experience.
Okay, thank you. The other question was, did you get a second opinion for your child's surgical procedure?
No, we did not. It had been in the talk. We had been talking. Please go in the other room. We had been talking a lot about this over the years, over the past couple of years, especially as her seizures got worse, what the options were. Obviously 2020 threw a curveball with anything that we had wanted to do, both surgical and we had other personal health issues going on. But it had been something we had been researching and looking at as an option.
Great, thank you.
Gracie.
Do you guys keep a seizure diary?
Yep. Try to keep a log of what happened when, what was going on, in an app on my phone. We also have a SAMI camera at night to record any seizure activity so that we will be able to send it to a neurologist as well. But yeah, I keep pretty good records. And Colton's going to come in and say hi too. Come here.
Okay.
Here.
Well, do you want to say hi to everybody? We're talking about how you had your surgery. Can you say hi?
Hi.
And why did you have your surgery? Because you have epilepsy. And have you had any seizures?
No.
No.
Yay.
Wonderful.
Nice to meet you.
You can help me walk. Help me again. Thank you. Thank you.
Yeah.
Yeah.
Very nice to meet you, Colton. Thank you for coming on.
Goodbye.
Bye.
Colton.
Oh, he's so cute.
Bye, Mommy.
Bye.
Aw.
Where am I going?
I missed them that little.
He's the cutest.
Hey, give me Peppa.
Okay, we have a question here. It seems like it's more directed toward Dr. Akila. So someone wrote that MRI results show that there are new multiple tubers growing and the old ones are growing bigger. She thinks surgery is not an option anymore, but a nerve stimulator may help. And the person said, "Doctor, what's your opinion? My daughter is 6 years old."
So, it sounds like when you're talking about tubers, we're discussing tuberous sclerosis as a diagnosis. This actually, I think my answer will sort of tie into the other questions as well as to when and how to pick a neurosurgeon. So basically, when we talk about epilepsy, especially in pediatric epilepsy or even in adults, it's, as an epileptologist, we're never just one person. It's usually a team, especially now with all these surgical options and interventions, diet considerations, and considering there are other facets or aspects of the epilepsy that need to be taken care of, such as behavioral health, emotional and physical therapy, all of these things and development, these things tie in together. And so it's very rare that it's one doctor that's making this whole, consideration for treatment options. So my recommendation for such a scenario is to discuss with your neurologist, who probably is working in conjunction with a neurosurgical team, and actually have them discuss what the different options might be. Interestingly enough, there are a lot of surgical options for tuberous sclerosis, even with a large burden of tubers. There are different approaches, and that's actually one of the epileptic syndromes that is very amenable to different surgeries. And so I think it may be worthwhile for you to be seen in a phakomatosis clinic where you have all the doctors who take care of patients with tuberous sclerosis, whether it's a surgeon, whether it's a neurologist, an epileptologist. All of these specialists come together, and we offer our expertise to see. Even we include the radiologists in there to see whether the MRI looks like it may be amenable to surgery. I wouldn't mind asking actually our neurosurgeon on the panel to maybe chime in and help out with this answer a little bit. Dr. Kennedy?
Sure, yeah, sorry, I can't be on video. What exactly is the question?
So there is it seems like there is a 6-year-old child with tuberous sclerosis who has multiple tubers growing, and old ones are growing bigger. she thinks that surgery is no longer an option, but maybe a nerve stimulator may help. What is your opinion?
Oh, yeah, thanks for the question. I think that it is, especially in a complex condition like tuberous sclerosis, where there are multiple abnormalities that can cause seizures in any given patient, in almost every patient with tuberous sclerosis. It's super, super hard to give any kind of advice, and probably not, terribly professional for me to speculate on what might be an option, because everyone's different. But what I can say is that many patients with tuberous sclerosis can have good outcomes from open surgery. If you can identify which tuber is causing a patient's seizures, or maybe even not all of their seizures, but just their most debilitating seizures, removal of that tuber can result in, it may not be a lifelong cure of epilepsy, because most patients with tuberous sclerosis have multiple tubers, and each tuber is known to have epileptogenic potential, or the potential to cause seizures. But sometimes someone has one tuber that is causing either the vast majority of seizures, or is causing just the most debilitating types of seizures. And those patients can have really good responses to resection of a tuber. But yes, there are other stimulators that we would also use in the tuberous sclerosis population, including vagus nerve stimulators, responsive neurostimulators, or deep brain stimulation. So I would certainly say that, we definitely operate on some patients with tuberous sclerosis, although it isn't necessarily the answer for every patient.
Yeah, so I think the answer to that would be, it would really have to be a collaborative discussion with the entire team, both surgical and neurological team.
Thank you both for that answer. We do have another question. Are there any educational resources that you recommend to help families make an educated decision? Or any resources in general that helped you make the decision?
For us, the Epilepsy Foundation obviously was a big thing. I was in a Facebook support group. They said I had a mentor. Shout out to Trisha, because she kind of gave me the heads up of what it was going to look like from start to finish. And just that real world experience, not just, okay, you're going to be in the hospital, this is going to happen. It was, okay, look, you're going to be up, or you're going to be down, and you're going to be happy, and you're going to be sad. Like, she told me the good, the bad, and the ugly. And the other one I went to was the Brain Recovery Project, because they did a very good job of explaining visual impairment after the kind of surgery that my son had. And they were very good at explaining it. So yeah, I did my research. I didn't just kind of go in blindly, but that's where I thought I got the most information.
We relied, I did research with the Epilepsy Foundation. John Hines just really researched different surgical options, and then some of the materials that were provided to us through our neurology team. As far as options were concerned, that was really our research and the pros and the cons of surgeries.
Awesome, thank you. And then this is kind of goes along with that, but have you joined or participated in any support groups? If so, would you recommend families to do so?
Oh, absolutely. It just was where I just got like I said, the real world, the nitty gritty kind of things. Like, even what's a path for the hospital? Like, they don't kind of give you that information when you're preparing for surgery. So get different people's opinions. For me, everything has been positive. I know it's not the case for everyone. So I don't want other families to go in thinking it's all, going to be perfect. There are ups and downs, and there are challenges, and, some side effects to it. But that's why you talk to as many people as you can.
We didn't necessarily join any support groups, or don't participate in support groups. I just, just different ways of managing. We do have friends that have adult children now with seizure disorders who have gone through surgical interventions, younger families with children with seizures. So I guess it's a support group, but it's not a formal support group.
Yeah, definitely.
Yeah.
Thank you. There's a question specifically for Dr. Akila. It says, after 2 years of patient being seizure-free, would you consider decreasing the anti-epileptic drugs even if the patient is doing well?
So, yeah, that, you know, one, I think particularly as a pediatric neurologist and pediatric epileptologist, my primary concern ends up being their development over time as well. So typically when I see patients who are on medication, I'm looking also at the long run, because obviously my patients, if they're going to be on seizure medication for as long as they know me, that'll be a longer time than if they were an adult. So for me, it would really, so I would like to minimize any amount of medication that might add or contribute to adverse effects. Part of me thinks, well, let's not rock the boat. If it ain't broke, let's not fix it. And they seem to be doing well. So it's not necessarily a one size fits all. Certain people, may be completely seizure free, but that's only on X amount of medications and, surgical options after that. So it's really individually based, but I think it's a good idea. And I find it in my practice always to, at every visit, keep considering what exactly is what is the child taking? Do they need all of this? Where are we standing with that? How can we optimize whatever it is that they're taking to control their seizures, but give them the best quality of life? So I hope that answers your question. So it's a balance, right? The end goal is really quality of life. So if that means maybe risking 1 or 2 seizures rarely to decrease side effects of medication and live a fuller life, that might be an option for some people. So those are things that I typically consider. So not so much so even full seizure control or freedom, not a perfect EEG. To me, the end goal that decides how much medicine and what kind and how long they will take it is really the quality of life. That's the end goal.
Great, thank you. At this time, we do not have any more questions, but we'll give it a few more minutes, see if anyone has any questions before we kind of wrap things up.
And can I just add one more thing?
Yes.
For us as a family, we went in this with the worst case scenario. I put in my head that, all the things that could go wrong and how recovery was going to look so that I kind of be prepared. And none of that happened, but I can say 100% and more that this surgery for my son was absolutely life-changing in ways that we never expected it to be. So we're obviously very pleased, but other people just keep telling me every day, like how well he's doing. And every week we see new gains. So even for us, like we struggle, like Grace's family, we didn't have many seizures, but then they started revving up and we just knew it wasn't going to get better. And that's ultimately why we chose surgery. And I would do it again in a heartbeat if I had to.
Thank you for that, Heather. I also did want to mention a lot of these surgical procedures. So, for example, Colton had a hemisphereotomy. What that means is addressing actual portions of his brain, you know, and opening up that spot and taking out the epileptogenic part of the brain. Now, interestingly enough, you know, the earlier we do these surgeries, the better the outcome. And granted, I think, you know, both as a mom and, you know, you kind of worry, oh my God, my baby, maybe they should be older before they can tolerate surgery. But, you know, the younger brain is so much more adaptable, what we call plastic, right? And so, just as Heather mentioned, you know, one of the outcomes that we have seen after hemisphereotomies, is actually improvement in language skills, because what ends up happening is, so once you take out the epileptic part of the brain, the rest of the brain is able to pick up any slack. And the younger they are, the other parts of the brain can actually learn those skills that was just being, you know, overtaken by the damaged part of the brain, you know, or the epileptic part of the brain. Similarly, you know, vagal nerve stimulators, they've been FDA approved for depression as well. And so we do know that patients who have had vagal nerve stimulators placed in, you know, there's a higher level of alertness, there is a mood elevation, less depression. So these are other, you know, sort of beneficial side effects to these surgical procedures. So it's not always just, you know, sort of, oh, you know, it's only about the epilepsy. As I mentioned, we're talking about a brain that has many facets and different aspects to it. Interestingly enough, these surgical procedures, even though we're doing it particularly for seizure control, they have, you know, fringe benefits.
Thank you, Akila. There is another question. I think this is a great question. Is there anything you wish you knew before the surgery that you didn't beforehand? And do you have any regrets?
I don't have any regrets at all, not a single one, except that maybe I wish I had done it sooner had it been an option. And there's nothing I really needed to know. The only thing I would really recommend is to make sure you have a good support system, like just for, you know, the time you're in the hospital. If you're in an extended stay, we were in 7 weeks. So, you know, things kind of fell apart home a little bit, and, you know, having someone to care for my children. So good family and friend support network, I feel, is very beneficial going into surgery. But other than that, I don't have any regrets.
Thanks, Heather.
I would probably chime in with Heather as far as doing it sooner, making those decisions a little bit earlier, or looking at those options a little bit earlier. We put it off for quite a while. Really thinking, oh, it's not, her seizures are only once in a while. Maybe this time it's not going to happen again. And really, it just, we look for Grace. One of our, and this is something maybe I should have said, is one of my worries as a parent for Grace, and my husband's worries for Grace, is her future. And she's a teenager. So as she grows and as, you know, we age, how are her needs going to be met, and how are those seizures going to be managed? So we're looking to really make this, you really make a lot of impact now at a young age, to make sure she's as independent as possible, and those who take care of her in the future are able to manage her needs as well as possible too. So it's kind of that's a big, and Grace has a lot. Grace also has, you know, and no different than I think Cole, and there's a lot. The seizures are one piece of the puzzle for them, as they are for everybody. So it's really looking at it, how it fits into our big picture as a family. The seizures, definitely. You know, are her brothers going to be able to take care of her if, you know, I'm at work, or those things. Or you're at school, yeah.
Mhm. Thanks, Carrie. Any other comments or any other pieces of advice that you'd like to give families tonight? All right, well, we don't have any more questions, and if there's nothing else that you guys would like to share, we can just kind of wrap things up. Thank you guys so much. Thank you, Carrie and Grace and Heather, for sharing so much about your personal journey. It was just so nice to hear your genuine experience. And Dr. Akila, thank you so much for helping out with some of those medical questions and giving us some more insight. So I'm just going to quickly share my screen and just talk to you a little bit about the EFEPA, and then Clarissa will talk about it'syourepilepsy.com. Okay. Yeah, so we at the Epilepsy Foundation Eastern PA are your local affiliate of the Epilepsy Foundation of America. We serve the 18 counties of Eastern Pennsylvania and provide education, support, and advocacy services to the 110,000 individuals diagnosed with epilepsy in their communities. We pride ourselves in being a trusted guide through the epilepsy journey. We provide many helpful programs and services. So we do many seizure recognition and first aid trainings. You know, we'll train school nurses, school personnel, students, law enforcement, EMS. Anyone that wants to be trained, we will train you. We have our monthly support groups. We also have, so we have general support groups. We also have a couple support group and a parent support group. We do advocacy. We have community and awareness events. You know, we have our Walk to End Epilepsy. We do educational conferences and webinars like tonight. We provide you with information and referrals. We have many youth, young adult, and adult services. And we have a young adult retreat. We have an adult wellness weekend, and we have Camp Achieve for kids 8 to 17 diagnosed with epilepsy. Now I'd like to introduce you to our friend Clarissa Martinez-Rubio at it'syourepilepsy.com.
Rena, before we continue, we have one more question that just
Oh,
arrived.
okay.
If you want to prioritize.
Okay, yes. So let's squeeze in this question if you guys don't mind. So I want to make sure everyone's questions get answered. So this person asked, can brain surgery or nerve stimulator reverse the brain damage caused by seizures?
That's a bit of a complex question. And I'm not sure that we really know the answer per se, because it's hard to necessarily quantify or understand what that interaction of multiple seizures on an epileptic brain is. You know, it's always a chicken or the egg story, right? And while we do understand that we do not want a brain to keep having seizures, but the question is whether or not each individual seizure causes any type of actual damage in one particular area. You know, so that's kind of difficult to necessarily say. So talking about reversing that damage isn't probably quite the question that we can answer at this time. That having been said, you know, in certain cases, if there has been some sort of insult or injury to the brain, then certainly we can remove that and, you know, take care of that affected part, thereby helping preserve the rest of the well-doing brain to develop properly, number one. Similarly, by you know, constantly having what we call a closed loop stimulator, such as the vagal nerve stimulator or actually the responsive neurostimulator. What happens is with these neurostimulators, we actually see that there is more seizure reduction with the longer you have it. So there's a better response over time, which means that these neurostimulators actually train the brain to stop having seizures. So it is a constant, stimulation that finally tells the brain, all right, that's enough, no more seizures. We're gonna quit this habit. So that's probably one way that it doesn't necessarily reverse anything, but certainly helps in the development of normal milestones and helps overall functioning of the brain.
All right, thank you so much for that. And thanks, Clarissa, for letting me know about the question. And I will go back to sharing my screen.
Thank you, Rena. it'syourepilepsy.com is a specialized website that focuses specifically on drug-resistant epilepsy. So if you or anybody that you know is looking for information about the diagnosis or all of the treatment options available from diet, yoga, mindfulness, all the way to advanced surgical treatments, please come and check out our website. Next slide, please. Also, we understand that some people don't like to have a lot of information. They want to digest it slowly. So you have the option of either reading through all of our chapters or just picking out the one-pagers that we have so that you can digest the information slowly. And we also, after all of these webinars, you will be receiving a one-pager where you have the takeaway messages, meaning that from everything that you've heard today or any of our previous webinars, you will have a summary of what are the key points that you should remember moving forward. Thank you, Rena.
Okay, so again, thank you all for spending your evening with us. Have a wonderful night, and we look forward to your attendance for our future webinars. Thank you again to our families, Dr. Akila and Clarissa. Good night, everybody. Thank you so much.
Thank you, everybody.
Thank
Bye.
you. Happy holidays.
Happy holidays.